My name is Chris and I'm a pediatric ophthalmologist. I did my training at Stellenbosch and then I went to England to study how to be an eye doctor. And then I came back and started working at Red Cross. And I met this lady, look at this young pretty lady here, called Sister Jacobs, and she was like the queen of the eye clinic. She ran the show and she is just exceptionally talented and experienced at everything related to kids with eye problems. So she is like an ambassador for eye disease in kids, and she helped me with the first year that I was there, and then she helped me get the job as the specialist at Red Cross for 10 years after that. So I worked in the eye clinic there, and it's very different from private healthcare because there's such a demand for services, and the services are overwhelmed, and they're underfunded. So waiting lists to get an appointment are very, very long, and it's hard to get a good service and communication with and engagement with government healthcare services. And now there's funding issues, so it's even more difficult. So there are a lot of barriers to the public service, and Niran will talk to us about that a bit later. So then after 10 years, I realized I'd had enough. And so I went into a private practice, and it's really like chalk and cheese, because instead of seeing 60 kids in the morning, I would see 6. And then you really feel like you can really spend time with the families and give them the time that they need to have conversations, to go into explanations, and to really get to the bottom of things in a very thorough way. And my practice is in Cape Town, next to Christian Barnard Hospital. It's a place called Cure Day Hospitals, and it's at the Atlantic Eye Clinic. So we've got a nice playroom for the kids, we've got a baby change, and everything is kiddie friendly. So it makes it much easier to examine kiddies when they're feeling safe and they're feeling like it's a game and it's fun. So the talk today is going to be about what causes visual impairments in our kids in South Africa, and how can you tell if a child can see or not see, and if they can see, what exactly are they seeing? I think that was what Tanar's mom was asking. And how do we help them to learn and thrive? And that's what this whole workshop is about. Okay. So let's just go back a little step and just ask ourselves, what is visual impairment in kids? And it's vision loss that significantly limits their visual ability or visual function. And it usually results from a disease, trauma, like Mr. Dupree, or it's a congenital condition, which means the kids are born with it. Sometimes eye conditions are passed on through families, through the genes in families. So kids can be affected from a genetic defect even though the parents are not affected. And those are called inherited eye conditions. And to be classified as visual impairment, it means that you can't fix it with giving glasses or medication or operating. And the World Health Organization has defined it as a visual acuity of less than 3/60, which means that the kids can't even see the top letter of the visual acuity chart. So they can't even see the top letter of the visual acuity chart. So that's a WHO definition of blindness. Or they've got tunnel vision, where they can only see a tiny central spot, and the rest of the vision is a blind spot. But practically, it's kids that can't tell if it's light or dark, kids who can't see or read print or write normally, or kids who can't move around without guidance. There are some kids that are partially visually impaired, which means that they're not blind, but they're not fully sighted either. And so they can usually see a bit further down the chart, but they really can't see much of the smaller letters. The problem with this is it's much more difficult to pick up kids with partial visual loss, And finding learners is more complex, and they're often missed, underestimated, or neglected. In South Africa, the causes of visual impairment are slightly different from the causes elsewhere in the world. A lot of places in Africa, childhood visual impairment are caused by avoidable things like vitamin A deficiency and cataracts and glaucoma, where they can't find the treatment. But in South Africa, most of our kids with visual impairment have conditions which are passed through families, so they're inherited eye diseases, or kids that are born with malformations of the eyes. Some of the kids in our clinics also have brain problems, so they have brain diseases or brain insults which go with the visual impairment as well. And they need a whole different set of care plans put in place to help with the neurological and the motor development. There are a few avoidable causes, and if you don't pick them up early, then the children will be blind for the rest of their lives, or for a significant part of their lives. So the first one is the inherited eye disease. This is the most common. So it's eye diseases that are inherited from parents or from even distant relatives. Often the parents are not affected. So for instance, Tien's kid, Christian, has got labors, but mom and dad are fine. So sometimes it's just a dormant or a carrier gene in the parents which comes out in the child. And the three types of vision, like examples of this, are kids with albinism and kids with retinitis pigmentosa, and then Leber's amaurosis. So I'm sure you've all seen kids with albinism before. They're just born with too few pigment cells in their bodies. So they have very pale skins and very light blue eyes and white hair. And because they don't have enough pigment in their bodies, they're very, very sensitive to light. And a lot of the kids, I think, at Athlone and Pioneer will have albinism. Other inherited eye diseases, another common one is retinitis pigmentosa, where there's a problem with the cells at the back of the eye that pick up dark, they can see in dark, and they can't see in the dark. When the lights are dim, everything looks black to them. It's like pitch black. And sometimes the problem with this disease is it can be progressive. So they start off being able to see well, and then later on they start losing the vision progressively as they get older, which is very sad and difficult to cope with as a parent of a child like this. And if you look at the back of the eyes, you see all those black speckles. That's just the retina, the film layer at the back of the eye that's becoming damaged and scarred down with time. As far as kids that are born with malformations, these are usually due to a mistake in the genes that are involved with making an eyeball in the mother's belly, in the mother's womb. There's some mistake that misguides how the eye is formed in the baby, and the baby sometimes then arrive with very tiny eyes, we call it microphthalmia, or sometimes no eyes at all, so the eyes just don't develop. And optic nerve hyperplasias, where the nerves that are coming out of the eyes don't develop nicely either. So those are examples of the main congenital abnormalities that cause visual impairment in kids. So some of these kids have vision, and some kids have no vision. So if you're born without an eye, like the kiddie on the left, then you may be able to distinguish between light and dark, but you might not be able to see forms or shapes. Like Tanar has something like this, where she has a very severely microphthalmic eye on the one side, but the other side she's got a tiny eye, but she can see something through that tiny eye, and that's what she relies on to see the tiny eye. But it's not a normal eye, so she can see something, but she can't see very well out of that eye. So Tanar's got microphthalmia and anophthalmia. And in the anophthalmic socket, she's wearing a prosthetic eye, which is like a glass eye. So that's why she looks so pretty, because everything is symmetrical. Optic nerve hyperplasia is, you've got Lamuel in the corner who's got that, and Dion's son has also got optic nerve hyperplasia, and that's just when the nerves going into the eye are underdeveloped and they're small, and so they cannot pass the signals from the eye to the brain. And that's a very common cause of visual impairment in our kids as well. Some children have got poor vision because they've had an insult, a cerebral insult or brain injury, or an infection like meningitis. So someone here has got the meningitis. Who had meningitis? You guys had meningitis, yeah. So the meningitis or the brain disease affects the centers of the brain that interpret what the eyes are seeing. And if those centers are damaged by the infection, then the kids will struggle to see. So there's not necessarily anything wrong with the eyeballs, but it's the brain's way of processing the vision that causes the visual impairment, okay? And if you have brain injuries, often you have other motor and neurological disabilities as well. So they might be physically behind developmentally. They might have spasticity or CP or weak on one side and that sort of thing. So those are things which then have to be factored in on top of the vision to help them learn and thrive and be vibrant like our star ambassadors. So the vision does vary according to the severity of the brain abnormality or injury, and care needs to be tailored to the child's individual needs and learning difficulties. Sometimes glasses can help if the eyes are out of focus or if they have a squint. I don't want to spend too much time on the avoidable causes because most of these are dealt with quite well in South Africa. If a child is born with cataracts, then it usually gets operated on. If a child is born with glaucoma, it usually gets picked up and operated on quickly in our country, thankfully. And there's not a lot of retinopathy or prematurity because we've got nice screening services in the Western Cape in any event, but around the country sometimes the screening services are not good. But just quickly, a cataract is where you have a whiteness in your pupil. And basically it's a haziness or cloudiness in the lens of the eye, which is behind the pupil, is the lens that focuses the light. And if it becomes hazy or white, then that's called a cataract. And it basically blocks the light from coming through the pupil and landing on the retina. So it's like having a dirty windscreen. It won't let the light through. And sometimes kids can have it in both eyes, and sometimes it's just in the one eye. But it's urgent to find these kids early, because the sooner you remove the cataract and clear the visual axis, the better their visual prognosis. Usually the kids have to wear glasses or contact lenses after the operation for a while until they grow into the lens that's put into their eye with cataract surgery. Glaucoma is a condition where kids are born with very high pressure in the eyes because there's also malformation in the eye. And eyes, because the pressure is high, the eyes just blow up like balloons and they get bigger and bigger and bigger. And so they need to have surgery early on. And the vision problems they can have can start off with blind spots in their peripheral vision, which then start encroaching, getting bigger, and involving their central vision as the disease progresses. So that's a different type of visual impairment. And you can see this child's right cornea is all hazy because the pressure in it is so high, and eyeballs looking big. And this child looks so cute, but actually his eyeballs are very, very, very enlarged because he's got glaucoma. And also that's something you need to pick up early, because otherwise you can end up with irreversible damage of the sight if it's not picked up early. And ROP is something which has become a problem in modern medicine because the pediatricians are so good at rescuing and reviving young premature babies. and especially those that are needing lots of ventilation and oxygen. So the problem in the eye develops because the blood vessel development gets interrupted when kids are born prematurely and exposed to oxygen. And the retina of the eye then starts to bleed and scar down, and it can actually lift off the back of the eye and cause a detachment and permanent blindness. So this is a problem in countries where there aren't doctors to screen the kids and to find the problem while it's still treatable. So how do we know if a child can see or not? So as eye doctors that work with kids, the first thing we do is we ask the mum, do you think your child can see? Because mums usually know best, and they know that if the child is not looking at them when they're feeding or not behaving normally visually, then mums usually know best. And that's one of the most important questions to ask a family where you are concerned about visual acuity in a child. From an eye doctor or an eye nurse's point of view, we can tell if there may be a problem by doing a test called a red reflex, where we look through a little handheld device and you can see the reflection from the back of the eye through the pupil. And if you've got a cataract or something wrong with the back of the eye, sometimes you can see that with that quick screening test. In younger children, sometimes they present with unusual blinking or eye rubbing, or they prefer sounds to images. I've had patients coming to me saying they just saw a scancel in the eye when they actually had an eye tumor, or they sometimes can't recognize people, or they're clumsy, or sometimes they just present with a skillwerk or a squint. Tanaz's mom was asking about how do we know what the children can see and what they can and they can't see, and that very much depends on what type of visual impairment, what the cause of the visual impairment is. So sometimes children have a blind spot just in the middle, and that's called a central scotoma, and sometimes it's a blind spot in the periphery, and then they've got tunnel vision, so they can only see through a small tunnel. And sometimes you can get patchy vision loss as well. So those are pictures of what children with these defects may be able to see or not see. How do we help them learn? So that's where's our optometrist? There she is. So the first thing to do is to check if the child's vision can be improved by spectacles. Once you've made a diagnosis, you check to see if the child's vision may be able to improve by spectacles. In most cases, it's not. So if you give glasses, they'll only have a limited improvement in the vision with glasses. But it's always a place to start. And then depending on how poor the vision is, sometimes low vision aids can help. So that's what Ashen was talking about. She had a device that helped magnify print and helped her to read and write more clearly. And Bev will go into low vision aids and do assessments with you guys tomorrow specifically to see if low vision aids might be helpful for your kiddies. And if kids have very poor or little vision at all, then sometimes we need to think about teaching them how to read with Braille. And that's also something that we're going to assess your kids for tomorrow and go into more detail tomorrow. Kiddies with albinism are very sensitive to bright lights. I think Tience's son was also sensitive to bright lights. Yeah. So they need dark glasses all the time in bright light, or these reactive light glasses where inside they're clear, but when you go outside they turn into dark glasses. In children with neurological disease, they often have multiple disabilities. So it's very important to assess the child holistically, and that's why we've got 3 OT sessions planned for tomorrow for each family, where we can talk about how to teach the children, how to play with the children, how to engage, how to bond. Unfortunately, we don't have counsellors for this inReach, but we will have counsellors next time. And we also don't have a social worker tomorrow, but hopefully in the next inReach we will. So it's important for families to get resources on how to engage with social work and get the grants that you need if your kids qualify. And so all of these allied medical inputs are important, like physiotherapy and occupational therapy and speech therapy. So in summary, we've got to try and find kids with avoidable causes early and fix them. If spectacles might help, then we've got to test them for them and prescribe them. Low vision aids will help if there is some residual vision that can be improved. But ultimately, we've got to identify the specific needs of each child. And sometimes simple things like just where you put them in the classroom is helpful. In kids that have high academic demands, so for instance, they're writing exams, sometimes we have to write letters to give them extra time to complete their exams and their visual tasks. But most important, it is to encourage and support the child and the family. And that's why we're all here today. So thank you, and have fun the next couple of days.